As you know, we've run a few interviews where we've interviewed particular members of the congregation about issues that are relevant to both the church and to our broader community. Today, in line with our conversations about mental health issues and some of the problems people have faced during COVID-19, we've got the honor and the pleasure to have none other than Shay Brown.
Welcome, Shay. Thank you so much for sitting down and having a chat with us. Yes. Could you tell us a little bit about yourself and the work that you're doing with the Kutoa Project on mental health?
Yes, so my name is Shay Brown. Along with my husband Jason, we run Kutoa Project here in Kenya. And basically, just a brief history, I was living here and just saw a huge need for kids and those transitioning out of children's homes and transitioning from, a teenager to a young adult, really just kind of missing out on the emotional and spiritual side. Homes and other places were providing basic needs and education and medical care, but then these kids have really hard stories and they never was able to process them. So we started Kutoa Project in 2015, so we run out of Thome, really close to the church, and we're really happy to provide care to children and youth 6 to 25 through our services. And then we also do caregiver trainings where a lot of people from OneTribe have also come to be trained on trauma-informed care.
Brilliant. And how have the communities around us been affected by COVID in your particular area?
Yeah, I think that this is a worldwide issue, and so we're seeing across the board that mental health is rising. We have children not in school, we have these big exams coming up, which is already stressful, but not to know what's going on. And then on top of it, families are facing crises that they weren't expecting. And so I think that mental health is up. I know in Kenya specifically, they're saying it's up by like 200%. On top of that, domestic violence and sexual abuse is up by 400%.
Wow.
And so,
because everybody's
because everyone's at home, they don't really know what to do with themselves, and then we have individuals who can't work right now, and so people are getting either back into addiction or starting addiction to cope with what's going on. And so it's a huge crisis that's happening on top of everything else that we're seeing, that people just need support. I think another thing that's really difficult is that their communities that they're connected to, they're no longer able to be a part of. We can't physically go to church anymore. We can't physically go to school anymore.
To get that support.
Yeah. And I think families are having to do crisis schooling right now. They're working from home, they're having to teach kids. And I think specifically here in Kenya, we have where I'm from in America, we have online school. Every child is doing online school, but here that's really not an option for the vulnerable communities. Yeah. And so I think that we're all seeing a rise in depression and anxiety and addiction and domestic violence. And so these are all things that we as mental health professionals are coming together. There's tons of us that are getting groups together to figure out what can we do when we can see people, and trying to come up with innovative ways to see clients. With us, we've been doing online counseling, which we did not ever think we could do, and it's actually working really well. And so we're thankful that we can support our children and youth, and then also on top of it, the caregivers, specifically in the children's homes that we're working in, they're kind of stuck there. Yeah. They don't want people going in and out, so now these caregivers are not getting a break.
Right.
And so that's causing a different kind of stress. So we just launched an online support for caregivers and doing trainings on self-care and other things so that they feel like they have a connection and a community to talk to too.
Yeah. Can you tell us a little bit more about just how are you reaching people with technology? What are you doing? You said online, but is it through people's phones, data bundles?
Yeah, so it's been interesting. So we're using Zoom just because that's the most confidential thing that we can find right now. Yeah, and it's free for people. Yeah. And so we have cases now from Limuru to Naivasha down to Kimana, and so places that we weren't able to reach before. Yeah. And so it's definitely difficult because especially at where my husband and I live, like we don't have power. It seems like 3 to 4 times a week, and so things like that do happen.
Impact.
And so I think that is something that's different and harder, but we've been amazed with what we've been able to do with online counseling and connecting these children back with the counselors that we have at Kutoa Project, because we took about a month break, like, well, what are we going to do now? Yeah. And then
you've had to reinvent yourself.
And then people were calling us like, hey, can we're seeing behavior issues, and we're stressed, and they're stressed, and we're all stressed.
Yeah.
And so, so I think the online counseling has worked really well for us. And it's actually, as of last week, our caseload has doubled. Before. Yeah, and I think another interesting thing is we have, with Nairobi, all the traffic that we have, we're only can see kids during the weekdays from about 4 to 6. And so that limits our time. And now we're being able to see them all throughout the day because we don't have to worry about them getting to and from us.
Yeah.
Now, can I just, on that one, what advice would you give to people out there who are struggling with mental health issues?
Yeah, I think that in Nairobi, we have tons of mental health professionals who are wanting to get connected and are doing online. We do have some in-person. Some clinicians are doing in-person still with the social distance.
Yeah.
But I do think that, reach out to your church, reach out to your people if you do need that, because we're all in this together. No one was prepared for this.
No.
And so we're coming up with ways. And I do think that here in Kenya, and specifically Nairobi, we do have a lot of professionals that are willing to help.
Yeah.
And I know for us, our services are greatly discounted. And so you can get really quality care right now during the season. And I think finding someone to talk to during this time, if you can't find a counselor, someone that you respect and look up to, pastors, spiritual leaders that you trust, I think
elders,
I think that people feel isolated. And I think that needs to be something that we can come together and help one another.
Great. Well, I think we've got to come into land a little bit now, I'm afraid. But how do people get hold of you, number one? Is there a website or a contact you can tell everyone?
Yeah, so for us, you can send us an email at info@kutoaproject.org. And then also, the church has our number. They have all of our information as well. And I think that I know that OneTribe in the past has sent out a couple ways to get connected to us. And so we would love to support and be a part of people's needs right now. And another thing that we do with Kutoa Project is give resources. And so we have tons of organizations that we're connected to. So if we can't fulfill a need someone has,
You know somebody who does.
we most likely can find someone that does. So
Brilliant.
Thank you so much, Shay, for your time and for the amazing work that you do.
Thank you so much.
In the community around us. And
Thank you.
Keep doing it.
Yes.
What an amazing resource.